welcome back to Dr. Dentico YouTube channel, and this video is a continuation part of Impaction. So in last video we have covered definition, indication, contraindication, theories and classification, right? But one classification was remaining, which was remaining of mandibular third molar in relation to inferior alveolar canal, right? So first of all, I would like to tell you that what is the normal appearance of inferior alveolar canal and the third molar. Okay, so in this picture you can see this is our what we say inferior alveolar canal boundary, right? So this one is the superior cortical boundary and this one is the inferior, right? And between this we can see this radiolucent band, which is nothing but our inferior alveolar canal, right? So this is a normal appearance of this inferior alveolar canal in radiographs. But we have to see here what is the relationship between this, right? So this classification was given by Home and Python's criteria, right? It was based on Home and Python's criteria. This was written in older books, but now in newer books it is considered as it is based on Root's criteria. Okay, this one is the recent literature. It is based on Root's criteria, okay, which is given by Root and Shehab. Okay, Root and Shehab, right? Now we will move to this classification. So first is criteria related to tooth. We have two classification here: criteria related to tooth and criteria related to inferior alveolar canal. Okay, so first we will start with criteria related to tooth. So what are the criteria related to tooth? In this we have three categories. So first one is this one is the first one, which is class 1. This is the class 1, which is this condition called as, this is nothing but our darkening of root. Okay, in this radiograph we can see darkening of root of third molar. How? You can see here, if inferior alveolar canal is passing just approx to third molar, or I can say they are on each other. Okay, so in this case we can see this darkening of root. Okay, so what I am trying to tell you, this is our third molar, right? And here we have our inferior alveolar canal. So you can see this is just passing on to the root. Okay, that's why here darkening is there, right? That's why it is called as darkening of root. Okay, so in this cases we have to take more precaution about inferior alveolar nerve, right? Then second condition is our this, which is called as bifid root apex, or we can say it apical notching. What we can say? Apical notching. Okay, why this is bifid root apex? In this you can see this one is the nothing but your apical notch. What is this? Apical notch. And this two notches are there, right? So this one is notch 1 and this one is the notch 2. So in this case inferior alveolar canal is passing in between the root. That's why here is apical notch, right? So it is passing in between the root. That's why it is a bifid root apex or apical notching, right? Now we will move towards the third category. What is the third category? Third category is our sudden deflection, or we can say band of root. Okay, sudden deflection or band of root. In this case we can see here inferior alveolar canal is passing and just above this root is sudden banded. Okay, it is kind of dilaceration situation, right? But it is a sudden band of molar root. Okay, so this is our third classification. Now we will move towards another, which is criteria related to inferior alveolar canal. Okay, this was about criteria related to tooth. Now we will move towards the criteria related to inferior alveolar canal. In this, first we can see is the absence of cortical outline on inferior alveolar canal. Here we are talking about inferior alveolar canal. Okay, so absence of cortical nodes. Now see, this is our this one is our normal appearance. Okay, what you can see, if root is just above the inferior alveolar canal, you can see here it is a continuation, right? It is a continuation. But if it is absent there, then you can see there is a space present, right? That's why it is called as absence. Okay, absence of cortical outline on inferior alveolar canal. So why we can't see this? Because it can be happen that it can be fractured also, or it can be happen that tooth is inside the canal, almost inside the canal. Okay, so due to this, what we can see, clinical radiographically haziness we can see, decreased density, decreased porosity, and decreased trabeculation of bone. That's why only space will occur, right? That's why we can see haziness, decreased density, decreased porosity, and decreased trabeculation. Okay, now in this we have a sudden deflection of canal. In tooth criteria we have sudden band of root. Okay, sudden deflection of root, sudden band of root. But here we have a sudden deflection of canal. Okay, you can see it is banded like this, like this. Okay, this is the sudden deflection of canal. Okay, why? Because of tooth is present like this here, right? Then we have third, which is narrowing of canal. In this we can see hourglass shaped canal. Why we can see this? Because of tooth is present there. That's why superior border of inferior alveolar canal is banded, but inferior is normal. That's why we can see this hourglass shaped of canal. Okay, in normally we can see this much is our what we say width of the inferior alveolar canal, right? But in this is one narrow. Okay, this one is narrowing of canal. That's why it is called as hourglass shaped canal. Okay, now based on this, what are the high risk criteria? Which criteria is on the high risk? Okay, so in this we have first is our darkening of root. We have seen first, okay, darkening of root. Then we have absence of cortical outline of inferior alveolar canal. If you can't find cortical outline on that, how will you going to be diagnose that, or how will you be go for treatment plan, right? So absence of cortical outline, then darkening of root, tooth is just above the inferior alveolar canal, right? Then sudden deflection of canal. So if presence of any two high risk criteria, that means now is absolutely passing through root or perforates root. Okay, in this cases it is very high risk. Any of this, if two are present, it is on high risk, absolutely passing through root or perforates the root. So this was about our third classification. So now we have covered classification part. Classification is over now. In next video we will going to discuss about radiographic things about this, like Vor lines, Warfare assessment and all those things, and then we will cover treatment part. Okay, so thank you so much for listening me, and if you have any doubt, please let me know. You can comment me, you can DM me on Instagram. You already know Instagram ID. If you are not knowing, then it is Dr. Dentico by Dr. Devyani. Please like, share and subscribe to this video. If you like this video, please make it more viral. Okay, thank you so much.